And good evening, everyone. We might as well get started. My name is Jim Salvi. I'm Chair of the Board of Selectmen, and welcome to tonight's public forum on PFAS. PFAS, as most of you know if you're here, is a chemical that can be toxic at certain levels. It is found in almost everything, unfortunately. It has been found in certain isolated sites in our groundwater in Stow. That has resulted in some water testing that has resulted in questions. And we are very honored to have with us tonight some state officials who are here to answer questions just for residents from Stow. I'd like to introduce them, and then I will very briefly say a little bit about how we'll proceed tonight, and then I'll turn the microphone over to people who can give you some good information. In the order that they'll present to us, first we have, and everyone knows her, our state representative, Kate Hogan. From the Department of Environmental Protection, we have Mary Jude Pigsley, and just stand or give a wave when I say your name. Mary Jude Pigsley, Regional Director of the Central Regional Office. Paul Locke, Assistant Commissioner of the Bureau of Waste Site Cleanup. Mark Baldie, Deputy Regional Director of the Bureau of Waste Site Cleanup. And Courtney Rainey from DEP, formerly of Kate Hogan's staff. From the Department of Public Health, we have Mark Nascarella, the Director of the Environmental Toxicology Program. And from the Department of Fire Services, the Fire Training Academy, we have the State Fire Marshal, Peter Ostrosky. And also we have our Stow Board of Health officials will be joining us. Marcia Noyes is with us right now, okay. The Board of Health was having a meeting, a public hearing, and they're going to be detained, but tonight is primarily about us being able to ask questions of the state officials. We'll have a bit of presentation where they will give you some information. We'll have plenty of time for questions and answers. I just want to say that we've gotten some inquiries from vendors, people who sell filters and treatment facilities and things like that. If there's anybody here representing a vendor, this is not the forum to be talking about your product. I believe there's a table outside. You can leave any written information there. And as people leave, if they're interested in talking to you, you can talk to them then. But during the Q&A process, that is for residents of the town of Stow to ask questions of our town officials or state officials. And without any further delay, I'll turn the microphone over to Kate Hogan.
Thank you, Jim. Good evening, everyone. First of all, thank you again to DEP, DPH, and to Fire Services for being here this evening and agreeing to a meeting pretty quickly and during this particular season, I know, where everybody is being pushed many different ways. We're very grateful to have this recorded for people that can't make it tonight, and we are also very happy to answer all questions. The PFAS issue has quickly become a pressing one for Stow, also for myself in other towns in my district. And during this process, Mass DEP has provided invaluable assistance in providing testing, in addressing the issues, mapping and remediating the contaminants in our water supply. And I can't stress enough how helpful they've been, how helpful they will be, and how they will help us get to non-detect in our drinking water supply. That is where I see us going. That is where I see it to be very, very important. So that tonight for me would be my answer to what is acceptable in drinking water is that we work towards zero in our water supply, that anyone drinking water would not be drinking PFAS once we have remediated the problem in homes and wells. During this process, I believe it is essential, and this is my second public meeting, to talk with constituents, to provide information, and know that we're there for updates on what testing and treatment means for our towns moving forward. The only good part of all of this is we are very far along in our testing, and in our understanding of what contaminants are where in our area and how we're going to be dealing with them, it is going to be an issue that will overtake the state. And so in that, we are early on for the early testing and remediation process with DEP, working with DPH and other state agencies. We will be able to know that we're in a good place to get this done. To anyone that I've already spoken to about the PFAS challenges in Stow, thank you for reaching out. We're here, DEP is here, Town Hall is here. We really are always able to give updates or provide information as is needed. And I'll continue to monitor. We usually have monthly meetings with DEP and many phone calls in between the remediation efforts. And I'll continue to be a voice at the table for action and accountability on all parts and in all parties that is required for safe drinking water. I've also been working to ensure that PFAS solutions are as much a priority at the State House as they are here in our towns as we're dealing with them in real time. I recently filed legislation establishing an interagency state task force to address PFAS. As water contamination by this forever chemical is discovered in growing numbers of communities, I believed it was essential to begin building a coalition for long-term solutions and creating a framework for coordination and collaboration. The task force will convene experts working on PFAS across state government, from environmental and agricultural scientists to public health and emergency response officials, to lay foundations for best practices in testing and in treating, and also in resource sharing. I would also add that it's important for us to stay in constant communication with our federal officials as the monies that might be needed and might be used for remediation may be coming from the federal government as well as the state government. But the task force will be charged with a clear and actionable goal, identifying sources of PFAS contaminants and exposure pathways, closing gaps in data and in protocols, examining the impact on the environment, including marine life, and enhancing public education outreach, which will be very important here in Stow, for instance, as private wells will need to be tested. The bill has significant bipartisan support in the legislature, and though I thought it was going to be passed in the most recent supplement, it was not, but it will be coming out of House Ways and Means and moving through the legislature, hopefully very quickly, even this month. After the bill's advanced out of committee with a favorable report, the House voted to establish the task force alongside the governor's investments in treatment, testing, and remediation. And Governor Baker has been very much watchful and thoughtful on the issue of PFAS contamination. And in that budget, supplemental budget that I just referenced, when it did pass today, there was $4.2 million for statewide PFAS testing and response across public and private water sources. And it also included over $10 million in no-interest loans for PFAS remediation projects, both large and small, through targeted investments. With passage by the House and the governor's significant stewardship on this issue, the PFAS task force is almost over the finish line. This should be a priority for our district, dedicated to making it a reality in the coming month, because it is resoundingly clear that our capacity to tackle PFAS contamination is very, very important. And what I know for sure is that while we cannot predict the scope and impact of each new PFAS challenge, we can lay a foundation for a more efficient response as we move forward, and we can build a pipeline to state resources, scale up access to public health information, and ensure that our tools are in place to reflect and respect the scope and urgency of what is at stake. So I'm here to tell you what we're looking at in the big picture, and I know that DPH and DEP will be able to get up and speak to you directly, as well as the fire marshal for the academy, about what we're doing here in Stow today and tomorrow to ensure safe water for everyone sitting in this room and in all the homes in Stow. Thank you for being here tonight.
Well, thanks very much, Kate. And let's turn it over to DEP, Mary Jude Pigsley, the Regional Director of the Central Massachusetts Office, Central Regional Office.
Thank you very much for having us here tonight. From DEP, the Assistant Commissioner for Wayside Cleanup, Paul Locke, is going to talk first about what is PFAS, what is the state doing to regulate them, and then I'll talk specifically about Stow and the investigation in the center of town where we've been sampling groundwater in the private wells. And I want to acknowledge Mark Mattis, who's here, who if your private well has been sampled, you've probably met Mark, who's been going door to door, introducing himself and explaining what we're doing. So I'm happy that Mark's been here in your beautiful community, and I'll turn it over to Paul.
Well, thank you. So I get to do the primer on what is PFAS. And another one. There we go. And talk about what we're doing about PFAS. Just before I get started, how many of you have heard anything in detail about PFAS, about what it is? And much better than most audiences. That's good. But if there's anything you have questions on, well, we're going to have plenty of time after this. I'm going to give a broad overview, and then we can get into details on the questions. So I want to cover the things that are up here, what we're doing to address PFAS, pollution prevention, sampling analysis, blah, blah, blah. So we'll move ahead. So just for the people who didn't raise their hands, PFAS is that's the term we use to refer to a whole family of chemicals that have similar structure. And it's typically, you see the animal up on the upper right-hand corner, it's typically a string of carbon atoms with some head at the end. This happens to be an acid, the O and then OH creates an acid. There are other forms of that include sulfur. But the important thing is there's a long chain, a head at the end, and the chain is covered with fluorine atoms. And those fluorine atoms in the long chain create a structure that is resistant to water, resistant to oil. It's resistant to breaking down. That carbon-fluorine bond is very, very, very strong, and it's very short. So other chemicals can't get close to break down the molecule. So you've heard it be referred to as the forever chemical, and it's because of this structure that it's very hard to break down. It's very hard to do anything with. All the reactivity, how we stick it on things, comes from the red end, the head at the end. And the toxicity, we believe, is related to how many carbons are in that chain. In general, the toxicologists believe that the longer the carbon chain, the longer it stays in the body and the more toxicity that it has. And that will be important as we move on and talk about this. Oh, no, I haven't even looked to see if I covered everything else. They're extremely stable, I think I said that. They're forever chemicals, they're water soluble. Water soluble, bad thing when we're talking about protecting people's drinking water supplies, because they'll get into the water, get into the groundwater, and flow with the groundwater. And some of them are very toxic. I guess I did cover most of these things. The uses of PFAS, they are very handy. They're very useful. These were wonderful chemicals, as long as we didn't know much about the toxicology. You know them as chemicals that went into things like Teflon. Anything that you think of as being water resistant or stain resistant or oil resistant, probably at one point or another was formulated with some PFAS compounds. Hairsprays, waxes on skis have been shown to be a big source of PFAS in ski areas. Paper coatings, there have been articles recently in the last year as we discovered that some of the takeout containers that are water resistant, so the paper doesn't get soggy. How do they do that? PFAS coatings. PFAS has been phased out. The manufacture of the longer chain compounds has been phased out in the United States since the mid-2000s. But we still import products that are made overseas that have these longer chain PFAS, the ones that are more concern in them, although that seems to be going down as well. And they're being replaced generally by shorter chain versions of these, which we believe are less of a concern. But again, more study is needed for that. Manufacturing, one of the sources that we'll talk about quite a bit is aqueous film forming foam, the formulation of which included PFAS compounds. It's a great fire retardant, a firefighting tool, and so many of the sites that we've been looking at recently, whether it's military bases or airports, have PFAS present because of the use of AFFF. And again, since 2006, this foam has been reformulated, and the newer versions don't have the long chain PFAS compounds, sorry, that we're concerned about. But the bottom line in all of this is that because of their utility, because they were present in so many products, we have all been exposed to a greater or lesser extent to PFAS compounds in our lives. So the exposures of concern and the toxicity, while we're all exposed, the people, the receptors that we're most concerned about are pregnant women and young children because of potential developmental effects. Thank you. I should have thought of that because I've been coughing all day. And the exposures of concern is through drinking water. Even though we're exposed to potentially to contaminated soil and air, these materials tend to, while they're soluble in water, they're not particularly volatile. They don't get into the air a lot. They tend to stick to soil to some extent. So soil is not a great exposure, is not the highest exposure pathway. When you have it in water, in drinking water, that is the exposure pathway of concern, how we're most concerned about people coming into contact with this material. And we're most concerned about women of childbearing age, pregnant women, and young children as receptors of concern. And there are ways of dealing with PFAS. It's the only kind of bright part of this whole thing is that there are relatively simple and straightforward ways to address PFAS, which is not to say cheap, but traditional, almost off-the-shelf carbon systems are available, and they can treat these longer chain PFAS compounds. So the water suppliers are familiar with these types of remedial technologies, and they have been installed in several systems in Massachusetts already. Sorry. Okay. Next one. I'm sorry, I'm just a little under the weather. So how do we currently regulate PFAS? And when I say currently, keep in mind that this in fact may change in the in the future, in the near future. Right now, we have a drinking. I'll do this for a little while. Thank you. We have a drinking water guideline, which we call an Office of Research and Standards guideline. Our Office of Research and Standards developed it. And that's 70 parts per trillion for the sum of 5 PFAS compounds. That came out in June of 2018. And about a week later, new toxicity information came out, which made us think about re-evaluating that guideline and perhaps lowering it. In the wayside cleanup program, which is my program, we are regulating and dealing with PFAS compounds on a case-by-case basis. We currently do not have any standards or any notification criteria for PFAS, so each case has to be dealt with on an individual basis. But what is changing in the near future is that we're going to a much lower standard of 20 parts per trillion, and that would be for the sum of PFAS, 6 PFAS compounds. So when I talked about the structure and how these compounds are very similar, varying on the carbon chain, we expect that that certain of these PFAS compounds will have similar toxicity to each other. So rather than regulating one by one by one of perhaps tens or hundreds of chemicals, we begin to look at it as a family and regulate it as a family. So we're looking at summing up the concentrations of 6 specific PFAS compounds that we believe act in similar ways and comparing that to the 20 parts per trillion number. We're in the process of revising the ORS guideline that would apply to drinking water supplies. We are planning and preparing to put out for public comment a drinking water standard that would be enforceable for public water supplies. And last spring, the Wayside Cleanup Program put out for public comment a package of reportable concentrations and cleanup standards for PFAS in soil and groundwater, so that at sites where PFAS have been released and have migrated into the groundwater, including into drinking water, we have the tools necessary to have those sites come into our cleanup program and to move to the assessment and cleanup process, and they have goals to meet at the end of that. We accepted public comment through July 19th, and since then we've been in the process of addressing those comments and preparing to finalize the standards, and those should be coming out in the near future. Like I said, those will be coming out in the near future. Both the final cleanup standards and reportable concentrations will be promulgated. The MCL will go out for public comment, and there will be a series of public meetings available for that, and the public comment period will probably last about 2 months to give people plenty of time to review it and make comments. And at the same time, the ORS guideline will be revised. Can you see these? These will be available online, I assume, right? The slides? Somewhere. Somewhere. Can you see this? So if they're visible, the EPA and many others started at a concentration of 70 parts per trillion for just 2 PFAS, PFAS and PFOA. Over the last few years, states have been looking at new toxicity information as it comes out, and the states have been acting more quickly than the US EPA and taking those new studies, new toxicology into account, and either lowering the number or adding more PFAS compounds to be summed, be looked at as a family, as a group. So Massachusetts went from 2 PFAS at 70 parts per trillion to 5 PFAS at 70 parts per trillion, and now we're going to 6 PFAS to 20 parts per trillion. The state of Vermont is at 20 parts per trillion for the sum of 5 PFAS. Connecticut looks at 70 parts per trillion for the sum of 5. And several states have taken the approach of looking at individual compounds and regulating them one by one, not adding them together. But they're looking at a similar low level in the teens to the 30s, depending upon the particular compound for these. And so the general trend over the last few years, as new toxicity information has become available, is to require lower and lower cleanup for these. In our water supply program, we're requiring PFAS testing for any new public water supplies that towns or people want to bring online. We're looking at where we know PFAS exists or where it's likely to exist, and we're doing targeted monitoring of public water supplies in those areas to see if, in fact, PFAS is present. We've been encouraging public water supplies to voluntarily sample, knowing and reminding them that as the MCL process progresses, when it becomes final, there will be a requirement to sample, and perhaps it's better to know as early as you can what you may have to be dealing with. We've been doing a lot of outreach to public water supplies and communities, and as we talked about, there's a high priority for the state revolving fund to make resources available to communities to treat the water when they find PFAS there. And I'm sure everybody appreciates the additional funding that just came through in the supplemental budget. So just to give you a good idea, somebody asked recently if this was the first community to have to deal with PFAS, and unfortunately, no. We've had hits of PFAS across the state. The first 3 that we had to deal with were down in Hyannis, in Westfield, and what was the third one? Devon's, big 3. But there have been additional ones as we go along. We talk about PFAS as being ubiquitous, it's all over the place, but I do want to point out that the blue dots up there are locations that have been tested and have found to be either non-detect or below the applicable numbers. So while we are seeing it across the state at various locations, we always have to remind ourselves that we're not seeing it absolutely everywhere. It's a problem where we're finding it, but it is not in every community. But we're seeing it from Cape Cod to Westfield in Western Massachusetts. And as we look more, we expect to see more. And you can zoom in, and that gives you a better view of the blue triangles that shows non-detects, but locations like around Devon's, for example, that have elevated levels of PFAS. And all of these areas that have elevated levels are being investigated by Mass DEP. Go on. So in the wayside cleanup program, I said we're developing reportable concentrations. Those are triggers that bring sites into our cleanup program. They do not exist at the moment. We published a sampling fact sheet to give the licensed site professional community, the consultants out there, guidance on when they should be looking for PFAS and where they should be looking for it. And what we're trying to do is normalize this situation as much as possible, bring these sites into our system and get them in the assessment process and get the people or the entities that are responsible for using these materials and releasing them into the environment to do the assessment and the cleanup of the materials. We're also working with the fire services to take back from local fire departments any of the legacy AFFF that they may still have in their possession, so that they'll be able to replace it with the newer foam material that is of less environmental concern. The sampling fact sheet is online. It tells people where to sample, when to sample, and how to interpret the results within our wayside cleanup program. And the important thing for me is to bring these sites into the MCP, the Massachusetts Contingency Plan. That's the regulations that dictate how sites are assessed and cleaned up. And what we've been doing is working closely with our drinking water co-workers. And as we're finding contaminated water supplies, the question that people then ask, well, after the who's going to pay to treat it, is where is this coming from and who put it there? Where is the source of the material? So DEP will initiate a site investigation to try to figure out where the PFAS is coming from and hopefully track it back to a responsible party who can take over the assessment and cleanup work. So we'll issue requests for information and notice of responsibility, and we begin a sampling program, either putting in monitoring wells and or sampling private wells in the area to see where it is, what direction it's coming from, and where it's going. And where we have a responsible party, we expect them to step up and take on that responsibility. But if there's not a willing and able responsible party, DEP has been doing that. And this is how we step out, I think. So if we find PFAS in a well, we'll draw a circle around that well and start sampling private wells or monitoring wells that are in the area to see where it's coming from or where it's going. And as we keep finding some, there we go, we'll keep drawing circles or keep looking at the next wells down the line so that we can tell what direction it's going or where it's coming from, and if we're lucky, track it back to a potential source. We've been doing this, as I mentioned, AFFF take back. We've collected more than 7,000 gallons of AFFF concentrate over the last year and a half or so. And this material has to be disposed of very carefully to make sure that it's not just creating a problem in some other location. So it's being sent for incineration at high temperature incinerators that get hot enough to actually destroy what otherwise would be considered a forever compound. And I think that's the end for me. We have a lot of material online. So rather than point you to it, if you just Google Mass DEP and PFAS, it will bring you to our website. We have a page that hopefully coordinates all of that information, whether it's what the proposed standards are from the wayside cleanup program down to what are sampling results for public water supplies across the state for PFAS, and much, much more.
So if Paul was giving a primer on PFAS, I'm going to give a primer on drinking water, how Mass DEP regulates drinking water and public water supplies, and then talk about how we got here in Stow. So I need to explain what a PWS is. And Mass DEP regulates public water supply systems that serve 25 or more people. And they come in different flavors. If you have 25 of the same people all day, all year round, it's a community system, so places where people live. If it's a non-transient, non-community system, the same 25 people per day, but not all the time, like an office building. Or you have 25 people per day, but they're different people every day for 60 or more days a year, like a restaurant, like a coffee shop. So these are the kind of systems that Mass DEP's drinking water program regulates. These are not standards that are set for private wells. Mass DEP doesn't regulate private wells the way we regulate the public water systems. So the state's drinking water rules really start with the federal government, with EPA, and Paul covered some of the stuff that I'm going to talk about, so I'll try to skip over. Mass DEP is delegated by EPA to implement the drinking water program, and one of Paul's slides had the UCMR up there. UCMR was the unregulated contaminant monitoring rule. It applies only to those systems that serve more than 10,000 people. Every 5 years, EPA comes out with a list of contaminants that they want to see what's the incidence of these, how are they occurring, are these chemicals that we should probably have drinking water standards for. So in the UCMR3, the third round of unregulated contaminant monitoring, EPA included these 6 PFAS compounds on that list. So if you were on a system that serves more than 10,000 people, your system was tested for PFAS back then. With that information came what Paul talked about, was that all of that data showed EPA that they really should work towards setting a national standard for PFAS. And they took the two, the PFOA and the PFAS, that are the most commonly occurring and commonly studied, and set that limit that Paul was talking about of 70 parts per trillion for those two. As Paul described, we took that same information and in June of 2018 came up with our standard of 70 for the 5. We wanted all of the public water systems that we regulate to realize that we were doing this, and we sent out letters to the systems to say, we have this number for PFAS, you didn't have to test for it, there's going to be a standard, we would like you to know that it's coming, that it was 70, that we're going to be reducing it to 20 in the near future, and that you might want to voluntarily test it before the regulation even becomes final, to get ahead of it and to be able to understand what's happening. So I think we can talk about Stow. So the UCMR, Paul covered this. In this region, we have a number of them, but the largest were Hudson Air and Devons. There are several small public water supplies in Harvard, and we're continuing to look. So we can skip that, that's Paul's stuff. So in Stow, Stow has 27 public water systems. Only 8 of those are community systems where people live. There's no municipal water supply, as you know. So nobody in Stow ever had to sample for PFAS. When we sent the letter out to communities, we expected that some of them would take us up on that, but there was no system for reporting back, by January 3rd, please tell us. So we weren't necessarily aware of what people were doing, but we developed this targeted strategy across the state to look at locations where we thought water supplies may have been affected by PFAS contamination, primarily around military bases, which includes Devons. So in August, this past August, we started reaching out to systems that were on our targeted list, and we said, well, DEP will come out and we will do the sampling for you. We will use our lab, we'll take the samples, and we will look for PFAS in your public water system. And the targeted list included 11 public water systems in the town of Stow. In August, I started calling people in these systems to explain what we were doing, that we were going to offer this, the state would do this for these systems because it was in the targeted list. And we reached out to the Neshoba Regional School District, and they told us, well, we already did that. We got your letter, and we did the sampling, which was excellent. We took a look at their results. They sampled in June, and you can see the levels that they got. So we took a second round of sampling, which are the August numbers. And as you probably know, the district immediately took action. There's bottled water being provided in the schools. The food is being cooked off site and brought in, and they are already well along in the way to designing treatment systems for both of these schools. After seeing the results of the schools, the town, being equally responsive, took a sample of the well that serves the municipal buildings in the center of town. That was in September, and you can see that result. Equally expeditiously, the town has dealt with this, and there's bottled water being provided in the municipal buildings. So, as Paul said, so we find these results, then we start looking, well, where else is it? If we have it in this well, where is it going? As of today, and very much up to date, as of right now, we've sampled 57 private wells in the area of the contaminated wells at the schools and the municipal buildings. As of today, we have 47 of the results back. 24 of the homes have PFAS levels greater than what will be the new standard of 20 parts per trillion, and Mass DEP, the Commonwealth, is providing bottled water to those homes. Here's a map. It's probably hard to see. I also have one on a board if you want to come up and take a look after, after we do questions, but it's a pretty basic red, yellow, green strategy. Green is good. Yellow is it was detected, but it was below 20. Red is it was detected over 20. So you can see the, you can figure out where the two schools are. The red dots represent their wells. They're red because they were over 20. The municipal building on the other side of the road is the red dot. That was 20. Then the shaded, you can't really tell, but they're hash marked. Those are properties that don't have private wells. They're on the municipal well at the municipal building. And like I said, you can come and look at that later. So we're evaluating all of that data. It's a lot of data. We continue to look at when we have a house. Yeah.
I'd just like to ensure that we're all going to be able to have direct access and ongoing access to that map after this meeting. Is that going to be made available to the public?
We can. Yeah, I'm not sure. I'm looking at Paul, who's sort of our web guru. It changes literally every day. But I don't have a way of, we'll have to figure out how that we can, maybe through the Board of Health, make that available. We can send it out as a PDF. But it changes every day. So we're evaluating that data. That's going to inform where we look next as we continue to chase the contamination. And we are still reaching out to those other systems that we're offering to do the sampling for. I was just at a condominium association before I got here, having the same discussion with them and offering to test their wells and help them determine what happens next if they have the detections. So, yeah. I'm sorry, I can't hear.
On Lake Moon, there was a problem with the water.
Yeah, I think we should wait.
Why don't we wait for questions?
So that's all I have. Mark Nascarella from the Department of Public Health can address some of the resources available for questions you might have about exposure.
So, good evening. My name is Mark Nascarell. I'm the Chief Toxicologist and the Director of the Environmental Toxicology Program at the State Health Department, the Department of Public Health. So your Department of Public Health in the Commonwealth has a cooperative agreement with the Agency for Toxic Substances and Disease Registry, the Federal Health Department. So we've been working on PFAS-related issues in the Commonwealth for a number of years. As Paul and Mary Jude has mentioned, there's a number of DoD-impacted sites in the Commonwealth as far west as Barnes Air National Guard Base in Westfield and as far east as Joint Base Cape Cod. And we've been dealing with communities that have been impacted by PFAS before there was an established toxicological criterion that could be used to evaluate the results. So at the time when people were being notified that they have PFAS in their water and we really weren't sure what to make of it. To the point now where we have amassed more emerging toxicology information, we have some criteria, but there still is a fair amount of uncertainty in what that means. And as you've seen from the chart that Paul showed, even the New England states, there's not perfect agreement between what those levels mean. So I say that in this environment because if you're sitting there and you're a little confused and it's a tremendous amount of information, we hear you because it's a tremendous amount of information from us. In the information, the toxicology information, the exposure information is changing rapidly. So the Department of Public Health can offer you, and our role here is to support your local health department in trying to understand and evaluate this issue, to be responsive to questions directly from all of you about health effects. I know this impacts a number of schools. Many of you likely have children in these schools. You are interested in what are the impacts to your child, what are historical exposures mean, and we're happy to work with you to evaluate that individually on a group basis. But historically, the best way that these meetings and these kind of questions proceed, especially as they relate to health questions, because your health concerns are individual, they're very personal, is, come up to me and we can talk after the meeting. If you have a general question, I'm sure there'll be a question and answer opportunity here. I'm happy to take it. Or you can reach the Department of Public Health. You can call staff in the environmental toxicology program, and we can help address those questions. We have information available online that addresses the health effects of potential exposure to PFAS, what that means, what it means when you have drank water that someone now has told you is above either a current or historical kind of exposure criteria, what that means for you and your family, and we can work through that with you. We have close working relationships with organizations like the Pediatric Environmental Health Specialty Unit at Children's Hospital, which is a premier regional hospital for all of New England, and they have the best clinical staff, I'd say, in the world to deal with pediatric environmental health issues for children, children's exposures to chemicals. So we can get you a referral to those individuals if you just want to have a conversation about health outcomes or what you've observed in your own child, and you just want to talk through, could this potentially be related to PFAS? And that's what we've offered other communities in the past, and it's worked out really well. I think those conversations have been helpful, and some of those resources available at the health department have gone a long way. So I'll be here to answer any general questions. I don't have a slide deck to walk through with you today. I think it might almost be too much information at this point, but I'm happy to take any questions from the group, or I'm happy to kind of peel off with you one-on-one if you have specific questions about any health outcomes in your family or questions about your neighborhood or your home. Okay, thank you.
Thank you, Mark. As you know, one of the locations that PFAS has been found at unacceptable levels is the State Fire Training Academy in the southern part of the state. Peter Ostrosky, the State Fire Marshal, is here to give us an update on that. And before I hand the microphone over to Peter, I just want to remind everyone that at the November 18th town meeting did appropriate money for PFAS treatment at the Hale School, Center School, and for the town building, town hall water system.
Thank you. Good evening. I'll just want to briefly update you on the actions and activities at the Department of Fire Services, where one of your neighbors at One State Road, as you know, the department has been there since the late 1970s and has, as part of our responsibility, a role for providing fire service training, which we use extensively the back area of our property for fire service training. In late summer, DEP, we were in communication with DEP about some of the activities around Stow and Hudson, and given our location, DEP asked us to volunteer to take some testing they recommended that we undertake some testing of soils, sediments, and water samples on and around our property. Ultimately, it was determined that we also have some contamination of PFAS on the property and surrounding the property, and hence DEP issued the department a notice of responsibility on October 24th. The department has, in the meantime, during the testing period and prior to the notice of responsibility, we did undertake a review of the department's operations. As you've seen, there are a number of substances that have PFAS components in use. One of them is firefighting foam. Historically, the department and some of the predecessor occupants of the property did utilize PFAS products as part of their functions. We did review our current status, and we have not used firefighting foam on the premises for some time. We found other methods to train fire service personnel using non-firefighting foam materials to be able to demonstrate those functions to the fire service personnel that attend our training. So I want you to be confident that the department is aware of the situation. We are taking a look at all of our we did take a look at all of our operations to make sure that we were not continuing or in any way contributing to any contamination, and we are moving forward with a number of actions. DEP, as part of the Notice of Responsibility, provided us with a course of action. That includes hiring a geoenvironmental company and a licensed site professional to review the test results, to provide further investigation, and to provide us with appropriate actions to undertake to mitigate or remediate any issues on DFS property and in the surrounding area. We have been able to secure an LSP on contract with the department. They have reviewed those test results. We have had additional testing done, and we are in the process of formulating a plan to take action to address any areas of contamination that have been identified and take appropriate actions. In addition, the Notice of Responsibility requires, and the Assistant Commissioner outlined the methodology that they use to determine where those testing areas are. We've been advised to have 9 wells in the area off of our property, but in the area, tested as part of the Notice of Responsibility. We have collected samples from 5 of those locations. 2 more wells will be sampled on Saturday, and we are working to contact and work with 2 others that we have not been able to contact to this point. But we are pursuing this as quickly as possible with our LSP. We have undertaken a process to look at our continued operations, in particular the use of firefighting, the water that we're using for firefighting purposes, how that would be treated and disposed of. We are undertaking that process as we speak. Thus far, DFS has met all of the DEP deadlines. We expect to continue to do that and work closely with DEP and other stakeholders to make sure that we quickly and thoroughly address any issues with respect to that. So that's the current status of the Department of Fire Services property and actions.
Thank you, Peter. Marcia Rising from our Board of Health is here with us. Marcia, do you want to add anything, or should we go directly to questions? Questions? Okay. So we're going to go straight to questions. What I'd like to do here, because we're being recorded, if you have a question, I'd like you to come down to what we call the well, either there or there, and speak into the microphone. I'll run the microphone back and forth. Let's treat it like town meeting. Say your name and your address, and the person who's answering the question can stand here and use this microphone. First questioner? First questioner?
Hello, my name is Andrew Benedict. I live at 54 Packard Road. I have a number of questions. The first one I'd like to know, though, is when we do the testing for PFAS, when the gentleman came to the house, he spoke with my wife and mentioned that it's very difficult for him to collect all the samples and get a clean sample, particularly because of the prevalence of the PFAS material. And I guess the specific question I have is, what is the lower detection limit you have for your testing, and what's the uncertainty in the results that you've provided to the town? as well as to the citizens here. All of you decide
So the labs that we use have to be certified for EPA Method 537 or Method 537.1. And what we're seeing now is that detection limits are getting down to about 2 parts per trillion. So well below the target level that we're concerned about. And there is uncertainty around those. The labs do various kinds of quality control samples to make sure that they're consistently hitting that and can quantify contaminants above that level. So we feel pretty confident when we're seeing those results that it's in the samples that's at the lab. The question about other kind of cross-contaminating the sample because of the ubiquitous nature of PFAS, that certainly has been a concern, and there have been, when a couple of years ago, as we first began large-scale testing at these low levels, there was a lot more concern about that. But there have been studies that are doing it and are still ongoing, kind of looking at the potential for cross-contamination, and we have not seen a significant problem with that in Massachusetts. But one of the things that we do if somebody samples their own home and they forward the information to us, we will make sure that gets resampled by somebody who has training and so that we have confidence that the sample was collected appropriately, and we get the confirmatory results back before we commit huge resources to deal with it. But what we have found is that the confirmatory samples come back pretty close to the original, so we're not seeing a lot of cross-contamination.
So I heard that your lower limit is 2 parts per trillion?
Different labs will have different reporting limits, but 2 parts per trillion in drinking water, 4 parts per trillion drinking water, somewhere around that range is pretty common now.
And you said that the uncertainty was what value?
I didn't say what the uncertainty was. And that will vary on the particular lab.
Can you give me an estimate on what I should expect? I saw 2 of the numbers for the tests for Hale. For center were different by 150%.
The tests, well,
For center, there were 19 PPT and 27 PPT.
so there are a number of things that can result in different results, including sampling at different times of the year. Since you're sampling groundwater, the variation in the environment can have different results as well. So variation is not necessarily attributed to uncertainty or variability at the lab. It can in fact be environmental variability.
So also, if someone doesn't...
Wait, hold on. Does anyone else want to ask a question? Okay. What's very helpful is if you want to ask a question, sort of like town meeting, if you stand up and go stand there, that way I know. Let me get to some of the people who haven't had a chance, but you can come back. Right. I want to go to the woman there who wanted to ask a question before.
Hi, good evening, and thank you for having this meeting. My name's Helen Lewis, and I live at 98 Kingland Road, which is over in the Lake Boone area. And I'm here tonight because in the summer of 2018, our well was tested several times for chemical TCE, and we had a positive test. And I don't see anybody talking about that, maybe because it's not a public supply and it is a well, but our rate was rather high, and we haven't heard from the Department of Environmental Protection still. And I didn't know if there was and it's been like a year and a half. And so I was just wondering if there's a protocol of retesting, because we may be over the limit at this point.
So We're happy to talk to you separately so that we can get to all the PFAS questions. Mark Baldie, who's the Deputy Regional Director for Wayside Cleanup, can talk to you about that.
I've got a pretty good line here, so formulate your question well. I'm going to have everybody ask one question, then move the mic.
Hopefully mine will be quick. Susan Crane, 122 Kirkland Drive. I don't live in one of the immediate areas surrounding the identified problematic areas, but I would like to have my well tested, and I know many of my neighbors feel the same way. And I wondered whether we can get any assistance from the state, whether we can get our names on the list for testing. If not, whether there are any individual contractors who might want to work with a group of residents and hopefully give us a group rate or something like that. But how can we get our wells tested?
So as I said, and hi, Susan. Mass DEP doesn't regulate private wells. We're testing the private wells where we are tracking the contamination. So in the supplemental budget that Rep. Hogan was talking about, there was some discussion about funds being available for private well testing, but I don't know how that's going to roll out. In other forums where we've spoken, people have asked the same exact thing. Are there any companies who are doing testing who will accommodate sort of a group rate? I don't know how that's turned out. Other people have tried to accomplish that. I would just caution people to make sure that you're using a reputable firm, exactly because of those cross-contamination issues, the things that you wear, the field notebook that you use. There are ways of cross-contamination. Don't go to BJ's and look for a PFAS test kit. I mean, this is pretty high-tech stuff, and I shouldn't embarrass Paul, but one of the meetings we were at, Paul said, basically you should just sample naked if you're doing this, because there's just too many things going on. So there are testing companies out there. Make sure they're using a certified lab. And if you have questions, we have information on the website about that, and you can certainly call my office and we can answer questions for you. Do you want to add anything?
Hi, I'm Marilee of Dartmouth. I live at 154 North Shore Drive, and I'm also on the Board of Health. I first wanted to indicate that all of the references and the information that you've talked about, we have links on the Stow Board of Health website, so people should be able to very easily access it. So my question sort of related to what was asked before. Is there any support for people with private wells, which is the majority in this town? If they've tested their well and it's positive or above the level, like I know you mentioned there was water provided to people that were part of your plan testing. And as well, I didn't know if you knew whether any of that funding was going to be available for people with private wells that were contaminated.
Yes, as I had mentioned, that money came through today. The bill itself came through today. I shouldn't say the money, that is very different. But the bill was just passed today. So now it's time to sit down and start talking about where and how, especially around private wells. That is one of the more difficult aspects of this issue in our towns. So hopefully we'll have something to say in a short period of time. You can, if you feel compelled at this point, go out and find someone reputable, and I'm sure that would be something we'd also be working with through Town Hall to ensure that people can, and that we would be able to find some monies that would be of assistance to people for both testing and possibly remediation. But that will probably be a little bit in the future as we sit down and figure out what we're going to be able to do and are able to do with the funds. So, but stay in touch, and we will be in touch as well.
If you do sample your private well, we would like to see that information, so you can send it to DEP, and there's a part of our website that I never remember the name, Safe Wells, WellSafe. I can get the information. It's something, DEP likes to collect information about private wells separate from PFAS even, and we do have a mechanism for providing that information to us, and especially in this PFAS context, we would appreciate getting any data that you get for yourself.
Hi, I'm Alan Fierce, 284 Red Acre Road, Stow. I have a bunch of questions, but I'll focus on this issue of private well testing. I live up in the northeast quadrant of town, which is not all that close to the schools in the town center, but we're all concerned about what might be in our water, and I've at least checked out what it would cost me to have my wells tested. Alpha Analytical is the approved testing lab in our area. I think they're in Westboro. But they are using Neshoba Analytical as sort of their entry point. That's the well testing service I always use for my private well. They're in air, but it's $350 to get your PFAS test. And I've heard different numbers of PFAS chemicals that would be tested for $350, either 14 or perhaps there might be a lower rate if they drop it to the 6 that the state is most concerned with. But that's a lot of money for everybody in town to go out and spend. I don't know how many households we have in Stow, but multiply that by 350 and that's a huge amount of money. And I don't think people want to wait until the state task force figures out what they're going to do and whether money might be appropriated to help out. And so I'm wondering whether the town of Stow shouldn't pick up that baton and run with it a little faster by either working with DEP and setting out a grid monitoring system across the whole town. If you just did 25 well tests gridded over the entire town of Stow, you might be able to tell me that the northeast part of Stow is clean and that I don't have to spend $350 and all my neighbors in that part of town. So I'm wondering if there isn't something that can be done now to facilitate that so that we all don't have to sit here and wait and pregnant women don't have to worry and lose sleep every night and young children who are in various parts of town can find out sooner rather than later whether we're drinking PFAS.
I think I can try to answer that, maybe with an assist from the Board of Health. It does take money, and Alan, you're as familiar as anybody is with how towns find money and spend it. Which is after a town meeting and after it's appropriated. Spending money on the local level is probably the slowest way of doing it. What a better idea might be is something like what Kate has in mind, where the town helps administer it, which is how we got over a big problem 10 years ago in Harvard Acres. The town certainly doesn't have any extra money ready to be appropriated or that has been appropriated that can just be implemented on a grid system, not unless the Department of Health has something I don't know about. I think, but we're all on the same page that something has to happen soon to help people out as much as possible. Is that fair to say? Board of Health want to add anything?
Marilee of Dokomoff again. I actually just have a question whether the idea about testing one place in the area actually gives you enough information to make a decision that it's probably safe in that area.
Part of it goes back to the question earlier about variability. And it just depends upon where the well is and how deep the well is and if you happen to hit contamination or not. I mean, what we have found in the testing that we have already done across the state and what we see in Vermont and New Hampshire and other states that have done the work is that where we're finding PFAS contamination at elevated levels, there is typically a source nearby, more or less clear, obvious. You know, there are military bases, there are industries that are using these materials. We are not finding a lot of just random situations. For instance, the there's a group working down on the Cape that has money to do research sampling private wells down there, Steep. It's Sound Spring, URI, I think it's URI, and Harvard. And they recently released about 100 results of private well sampling down there randomly across the Cape. And what they found with 100 samples is that 3 were above 20, about 50% had detections, but less than 20, and about 50% had nothing, at non-detect at those low detection levels. So all of which is to say that while a grid sampling or random sampling across the state would be good for getting a sense of the ultimate distribution and concentrations, and I think that's part of what we need the funding from the supplemental budget to do. It's never going to answer the question of whether your own home is contaminated or not, whether it's with PFAS or trichloroethylene or nitrates or something else, because there is a lot of variability. But I think with PFAS, you know, it's usually associated with the source. Or if you're living in an area that there's not a lot around, it's likely to be less of a concern.
Hi, I'm Don Michael, 19 Great Road in Stow. The gentleman that just preceded me answered 2 of my questions on relative cost and qualified labs. So my remaining question is a little more technical. You mentioned method 537 and 537.1. How do they correlate to, do they measure 2 compounds, 5 compounds, 6 compounds? How do they correlate to the pending standard?
So method 537 and 537.1 are US EPA developed methods that are used for the drinking water program. And I believe right now they're quantifying 14 PFAS compounds, and that includes the 6 that we will have a cleanup standard for.
Hi, my name is Maureen Sheehan, and I'm a resident of Center Place, where it seems to be there's a high, there's a high level of contamination in that area, and we're right near the schools and the municipal buildings. And very curious as to, have you identified any of this, what source could have collected in this area, as well as the other question I'm very concerned about is, so I have the equipment installed in my home, let's say, eventually to attract or extract these elements from my water that are contaminants or toxins. And then as they accumulate in the tanks in my home, what happens to those toxins? Am I collecting like a little bomb of toxins in there, and then who gets rid of it? Who takes care of it? And who wants to take care of it once you have accumulated all of that?
So in terms of a source, one of Paul's slides showed how we look at the contamination and we go out from there to see where it is. And that's what we're in the process of doing right now, DEP, with the private well sampling. Our concern is that we find where it is so that where there are exceedances, we can get bottled water to people. So in the first instance, we want to identify the exposure and deal with that. And so we're going to then take the data and try to figure out where it's from. But right now, we want to see where it is. So that's the task that we're working on right now. The vendors will take back the used media in the treatment system. So part of the, at least in the large public water systems that we see with treatment, the carbon can be, I always get it wrong, the carbon can be regenerated. So they'll take it away and they'll make it fresh and clean. There's also an ion exchange resin that's used for treating larger volumes of water, and I guess that has to be destroyed and it's incinerated. So it's not something that the homeowner would be left with. That would, I don't know how the cost works. I mean, it's, yeah. It depends on the flow rate of the water. A house is having a very low flow through a treatment system. It does depend on the concentration and then what the size of your treatment. And someone who is in that industry could talk to you about that. It's just, we don't have the experience of treating private wells, except in the instances like this where we're doing, we're mitigating the exposure for right now, and we just don't have a huge amount of data yet because we're right in the thick of it. I don't know if you have any more about the poets.
Hi, my name's Jim Wheeler. I live on Randall Road in Stow, outside of the hot area. I'm happen to be a geotechnical engineer. I have a very good understanding of what you guys have been talking about, the plans that you described for finding a hot spot, dealing with it, spreading out, trying to trace the source and everything. It's a very logical approach, and I understand what you're trying to do, to find where everything is, find a source, chase it out, remediate it, protect the people's health as they're in the situation. I've been following this for, probably 6-8 months. And first I hear about it, well, it has to do with this fire suppressant stuff. And they found it at Devon's, and then they found it down at the Cape, and now they found it at Hudson, and well, that's close to, so, okay, maybe it's a fire suppressant thing. And then you find out, well, gee, we have it here at Stow, and I'm going, well, how could it get here in Stow? Well, we have a fire department in the middle of Stow, so maybe it had to do with the fire department. That makes sense. And, well, we have a fire academy down the other end. They must use that stuff down there. Well, that could be a concern, too. So it began to pique my interest as to what's going on here. And as you follow it more and more, those of you that might have read the Globe in the past couple of weeks, we're talking about the MWRA. I guess before that, I take it back, there was the Lowell treatment plant. Was asked to treat leachate from the landfill in Manchester, New Hampshire. They would send the leachate that drained from the landfill down to Lowell. Lowell would put it through their wastewater treatment plant and discharge it into the Merrimack River. But Lowell is not treating for the PFASs. So I'm sitting there going, that's really stupid. We're sitting here filtering stuff out. People are paying for this, paying for that, and dumping it back in the river for the people downstream to deal with. That doesn't make sense. Then I start hearing about the MWRA. We did a wonderful thing 15 years ago, 20 years ago. We cleaned up the harbor. We took all the solids that were going into Boston Harbor. We filter it out into a system. We send it out to Deer Island. We process it. We send clean water 20 miles out in the middle of the ocean. We take all the solids. We send them down to Quincy. We make fertilizer with them. The fertilizer has PFAS in it. So my question here is, we saw a beautiful map up here that showed the hot spots across the state and all these blue places where things are good. Has anybody overlaid where we're selling the fertilizer? This is an agricultural town we live in. Are we using the fertilizer here? I live across the street from a golf course, which uses plenty of it, and plus we have apple orchards. How does that filter into your plan for looking at the concentration of PFAS here in town and also other places in the state?
Well, I mean, I can speak to the investigation that we're doing in Stow, which is, again, we're following what we have in the center of town. We're not going to look for places where it might be. We're looking where it is. We're aware of the issues with the residuals, the biosolids. I mean, Paul can speak to.
So the residuals and the biosolids, I would view it as coming at it from two directions. One is we've already put in place a requirement that in order to renew their permits, their license with their certificate of acceptability, it's not my program, I'm not sure I have the term correct, that they have to test for PFAS. So that's kind of on the front end. On the people, any generator of biosolids, seller of biosolids who are seeking approval for use of the materials. So the people, including MWRA, the people who have the permits. On the back end, and again, going back to the sampling that we hope to accomplish with the supplemental funding, is as we go out and look, some of that money, some of that sampling can be targeted to potential sources. And the use of biosolids and the application of fertilizer is one of the potential uses that we would like more, we need more data on. So sampling of private wells near those kinds of potential sources is one way for us to get a handle on how big the scope of the problem is and where the contamination might be. And that kind of funding is vital to give us the tools to be able to do that.
I'm Mark Taylor, 21 Orchard Drive. I'm in the Villages at Stow. Hi, Mary Jude. So I really appreciate you guys furnishing this map and just taking a look at it. I know we're still in the process of spreading out from this area, but it does, given the fact that we have some green properties around the perimeter, it does give me the impression that hopefully it's a fairly localized hotspot here in Stow, and I get the impression that we have identified the sources for some of the other hotspots in Hudson and around Devons. But have we talked to some of the longtime personnel from our local fire department to see what the history is of the use of firefighting foams at the local, the old fire station there? Because that would be the first place that would occur to me might be the source of some of these contaminants.
Mark Baldie has in fact spoken with the chief.
I spoke with the chief today.
Do you want? You need a microphone.
Yes, I spoke with the chief today because the old fire station is at 16 Crescent Street. We had heard from residents, Mark in his sampling had heard from residents that there had been some training, fire training going on there, so naturally that is a concern right here, this property. The chief said to his knowledge, AFFF foam had not been used in training there. It's expensive. He claimed that his budget didn't accommodate that. He said that one time they had used a type of protein foam, a fish foam, he called it. It may warrant some further evaluation.
And other than that idea, there's no other theories about what the source might be? Are there historical records of fires that were fought in this area with foam or any other sources?
Those are good questions. Certainly we will look into that. We have been issuing requests for information. And that's the kind of questions that we do ask.
I've heard indirectly from not the current chief, but an old chief. Although the fire department has always trained on that apron, the use of foam, they say, was almost non-existent. But we'll see. I mean, it leads where it leads.
Dan Barrett, 66 Packard Road. I'm curious about if the water in an area has been determined to have high levels of PFAS, what that means for agricultural irrigation. Do plants uptake the PFAS? Do they concentrate it? Are there certain species of plants? I know like in the past, like mustard plants will uptake more heavy metals. I don't know how this bioaccumulates.
So that's a really good question. There's evidence emerging in this area quite frequently, much like all of the toxicology information. New information is coming out on PFAS levels in plant tissue. I can tell you that, my understanding of the literature at this point is there is not a specific type of plant or a specific type of plant tissue that appears to accumulate PFAS to a significant extent. In impacted communities in Massachusetts, where we have previously measured agricultural areas that are impacted by PFAS, we haven't measured detectable levels of PFAS.
Andrew Benedict, 54 Packard Road. I was wondering about, now that we've been talking a lot about identification and trying to find the source, I wanted to ask again about remediation. If a person's house has been identified as being above the limit, is there a plan for remediation? If some sort of filtering system is going to be installed, who pays the installation costs, and then who pays the ongoing maintenance costs for that system?
So in the ideal world, we identify a potentially responsible party, and they take the responsibility for doing the sampling and doing the remediation and any costs associated with that. For example, down at Martha's Vineyard at the moment, there's work being done around the airport, and the neighborhood adjacent to the airport has been affected by PFAS in the drinking water wells, and the airport has stepped up, and they're doing that work under the 21E program. In other cases where there is not yet a potentially responsible party, Mass DEP has the obligation to make sure that imminent hazards to health, safety, public welfare, and the environment are addressed. And in that context, where there is not anybody else willing and able to do that work, Mass DEP has stepped up and provided bottled water in the short term, and in some cases, point of entry treatment systems in order to address the imminent hazard, as is our statutory obligation. That said, we have to be very careful with the state money because there is not a lot of it. And so in each case, we try to be upfront and have to look at what the particular circumstances are, what the levels are, whether there is an imminent hazard or not, and a number of factors that go into that.
Hi, Alan Fierce again. Well, I'm glad you mentioned, Paul, health, safety, welfare, and the environment, because I want to ask a question about the environment in connection with the Fire Academy, because we have not yet heard what the levels were in the testing at the Fire Academy, and the fact that an NOR, a Notice of Responsibility, was issued suggests to me that it was significantly higher than the homeowner numbers that we've been seeing around the center of town. So I'd like to know what those numbers were, and then that Fire Academy is surrounded by another number of sensitive environmental areas. There's a state forest that abuts, there's the National Wildlife Refuge, which has White Pond. There are brooks and streams running very close to the area. What do we know about the environmental impacts, not just to agricultural products, but to, you know, the critters, the fish, the biota in the area when they're at levels that we have down at the Fire Academy?
So there are a couple things to unpack there. I'm going to start with the environmental stuff first, as people thumb through looking for levels. So with PFAS, it is a moving target, but it's the amount of research that has started over the past 5 years or so is incredible, and the results are coming in now almost on a daily basis. A lot of that has focused on human health risks, less so for environmental risk. What we do know, and what I can say off the top of my head, is that in the levels that we are looking at for levels of concern in surface water are significantly higher than the levels of concern for drinking water for humans. So it's not quite at the PPT, parts per trillion level that we're seeing. So where we do have PFAS in water, we'll expect an evaluation of potential ecological impacts for that. But for example, our groundwater 3 standard, which is based upon eventual discharge into surface water, is a lot higher than this standard based on drinking water. And as for the NOR to the Fire Academy,
Well, there is a release tracking number associated with the NOR, and I'm sorry, I don't have it in my folder. I thought I did. Mark may remember it. Do you have any of the, like, do you have the NOR with you?
No, I don't.
It's the same way if you Google Mass DEP PFAS, if you Google Mass DEP, look up sites or sites and spills, it takes you to a page where you can put in a town, you can see all the 21E sites in your town. You can put in one state road, it'll come up. You can put in Department of Fire Services, it will come up. And do you think?
So the sampling at the Fire Academy, Mass DEP installed a number of monitoring wells to look at the groundwater. We did some sediment sampling. We did some sampling of surface water in White Pond. And there was an area behind the training area where sludge had been deposited from the tanks that the training water empties into. When they emptied those out, the sludge would go out back. The sludge had very high concentrations. I believe they're on the order of 5,000 parts per trillion. The fire marshal, just the other day, they submitted an estimate on removing that sludge, so they're jumping right on top of that. The groundwater, what I recollect is the concentration in groundwater was approximately 100 parts per trillion, maybe, the highest concentration. In White Pond, the surface water samples were on the order of 60 parts per trillion. So it is there, it's above the drinking water standard, but they're not in a drinking water area per se right there. Does that help?
So we've been at this for a while. I just want to say, out of respect for the travel that our panelists may have to do, I'm going to cut the questions off after these three individuals.
Okay, thank you. Chris Funkhauser, 27 Carriage Lane. My question is about the history of PFAS testing in Stow. The earliest dates I saw referenced on the PowerPoint were June 2019. Do we have any knowledge of how long PFAS has been in the drinking water for those of us that have been in the affected area for decades and have been drinking the water?
I'm going to say no, because I'm hearing no. I believe that those were the early, the tests that were done. Typically, in environmental sampling, this is a new compound for us in the environmental field, so we would not have expected anybody to have sampled for PFAS prior to that, really, prior to these first initiatives.
I think part of the answer to that question is a lot of the testing was motivated by the change in standards. You may have noticed none of those numbers was, except with the possibility of things at the Fire Academy, none of those numbers was above 70 parts per trillion, which until a year and a half ago was the accepted standard nationwide, well, in Massachusetts.
Hi, I'm Ann Carley. I live in one of the red areas, unfortunately, on Boxville Road. So we've been drinking that water for 31 years. And I'm wondering, or hoping maybe, that we, both have the filter for iron down in the basement, and then also a fridge filter. And if there's any chance, I know they're not specified for PFAS, but is there any chance that that's taking out some of it a little bit? And then is there any benefit to, do you get a blood test to find out what your levels are? I mean, is it good to know? Is there anything you can even do about it if you do have a lot in your body?
So those are great questions, and thanks for asking them. I will say, one thing to address I think many of you are probably wondering about the historical legacy contamination, right? It's recently been identified this summer, and what does this mean for me? I think an important thing to keep in mind is that these regulatory standards, whether they're guidelines or they're enforceable values, they're bright lines for my colleagues that are the regulators. They trigger a regulatory action. Like, let's figure out why this is here, and they start to identify the source and look for opportunities to prevent exposure from any of you and try to figure out why did this contaminant, how did it end up in my water? That's different than saying it's a bright line that above which you should expect adverse health effects. So I think that's important to keep in mind. There's a lot of factors that would lead to someone experiencing an adverse health effect from exposure to water above a certain level. Those factors relate to your own water consumption, your own physical activity, the differences between being a man or a woman, the differences between being a larger man or a larger woman, the difference between a boy and a girl, all these kind of things, the amount of water you drink, when you drink it, all those factors. And we assume, we make worst case assumptions when developing these standards to make sure that we can protect everybody in a population. And then we set the level at that level. So when you exceed it, it doesn't mean automatically you're at risk. So something to keep in mind, it's a concern. We want to eliminate PFAS in water, but it doesn't immediately mean that your health is at risk. With respect to should I go to a clinician and should I order a blood test to determine if PFAS is in my body, the Department of Public Health and the Centers for Disease Control does not recommend that. There is no diagnostic use for that test. When your clinician orders that test, there's not something that knowing that information will inform. There's no way to say if it's in your body, take it out of your body. I can tell you with scientific certainty, because we do this in the United States, we measure PFAS in people's bodies. There's a large CDC study that's conducted on a 2-year cycle where we collect a representative sample of people in this country and we measure PFAS. And we measure PFAS in just about everybody we test. So it's in all of us. It's from all the different sources that Paul identified. It's in our food containers. It's why it's such a problem when you're sampling, when the samplers go out because it's out there. So it's in our bodies right now. So when you go to the physician and have that measured, there's nothing that can tell you. More importantly, the actionable item, the public health intervention after you determine that there's PFAS in your water is to stop drinking the water. It's not to go to a clinician and get a test. And I think that's the recommendation and sort of overarching message here is to consume clean, fresh water and eliminate the source. And that's really the best outcome of that test. And that's what a clinician would tell you if you had a level of PFAS in your body that was, say, different than someone sampled from this larger study I told you about. They would say, well, why do you have PFAS in your body? And if you're somebody that's been drinking that water for 30 years, a reasonable explanation is, well, it's probably from my water at home. And that clinician will say, well, stop drinking the water. So that's why we don't recommend it.
Mark Taylor again, 21 Orchard Drive. So to follow up on that, I am the parent of a college-age child who went to Center in Hale and was drinking the water all these years. Is there, and I recognize that the science is still evolving on this, but is there anything that as parents or him as an individual should be vigilant for with regard to his health, things that he or his physician would look for outside of what physicians would normally look for when he goes in for his checkups?
Sure, it's a really good question. Excuse me. A lot of the things that PFAS impact in your body, things like your liver, like your kidney, immune function, are things that your physician tests for already with the routine clinical chemistry tests that they run, the blood sample that you provide to your clinician, your urine sample. So the best recommendation for a child that's been previously exposed to PFAS is to continue to advocate for that child to have their annual checkup. Let the clinician know that this was a potential exposure in the home or a potential exposure at the school. We have resources available to educate the clinician on PFAS. So if this is a chemical they've never heard of, we have a clinical guidance that we can give them to bring them up to speed. We can link them up with clinicians that are trained in these kind of medical toxicology or environmental health issues. So if they see something that they can't explain within the universe of their practice and say, this is something different, we can connect them to a resource to evaluate it. But in general, there's nothing you should be advocating for your child that you wouldn't already. An important consideration also is that a child that is only exposed at the school is potentially only getting, if the exposure is only at school, half the water they are drinking, assuming they're at school 8 hours and the other 8 hours at home, and 8 hours they're hopefully asleep, right? So that's the 24 hours in your day. It's only half of the water they're consuming is potentially contaminated. And that's good, because then the other water is clean, fresh water at home. So it means their exposure has been reduced. They're exposed to less PFAS. So that's, I think, good news.
All right, and finally, Susan, you had some piece of information, right? Not a question?
I just looked up the release tracking number for the Firefighting Academy. So if anyone wants to see the documents, there are a dozen documents online on DEP's website, and the number is 221045, and that would read RTN number, and that will tell you all about the testing and future testing proposed at that site.
All right, thank you. Thank you. We have one small response.
All the reports that the fire services submits, as Susan said, will be online. And I think the next submittal that the Fire Academy has due is December 24th, Christmas Eve, for the immediate response action plan, which will have the details of the private well sampling, the sludge removal, and any other monitoring that they're doing. So that's something to look for.
Thank you. And do I have any final word from any of our panelists? Kate.
I don't want to keep you here any more than you need to. I just do want to say that this is an issue that we are dealing with in real time. So when we say the money has just come through, the bill has just been passed, now we have the money, now we sit down with DEP, we sit down with the town, we figure out how we move forward. It's really important to keep one issue moving in front of another so that we know what we're doing, whether we're continuing to look at the sites that are contaminated and moving beyond that to each of the homes. How are we going to deal with private wells, very different from other forms? That we're going to be figuring out as we work through it. So please understand this is all in real time, and a lot of what we're going to be doing for the first time through state government, which is why I think in the long run the task force will be important. But we are in the forefront of dealing with it, and that is the good news. And it may seem that we are now going to have to go and figure out what we are going to do. That's right, and we will. And there's science that is has occurred, and there's science and there's data, and we're starting to be able to put all of that together. But certainly I think the most important thing to know is that we will deal with it and we will move forward, and we have some of the tools in hand now to do that. So thank you all for being here tonight.
Everyone, thank you very much for turning out tonight. Really appreciate it. And how about showing some appreciation for our panelists? Thank you, everyone. Have a good night.